The Unfiltered by Jade.
Jade.
Welcome to The Unfiltered by Jade, where we get out of the box and dive into topics that are sidelined. I look forward to entertain, educate, and inspire. Feel free to like, share, subscribe, donate, and make everybody know about this.
Beats by RB Records.
Shopping assistance, your style, your budget. Our services include online and local shopping for individuals and businesses, personal shopping, purchasing of company and office supplies, importing and exporting small packages across Jamaica and worldwide, and helping you find unique gifts and items for all events and occasions. Contact us at 876-919-5195 or shoppingassistance2015@gmail.com. Shopping Assistance, your style, your budget.
Welcome back to The Unfiltered by Jade. Today we have with us here Beth Goldstein, and she's here to speak with us about understanding your skin. Hi, Beth.
Hi, thank you for having me.
No problem. So before we even go into it, I want you to introduce yourself to the audience.
Sure. I am a dermatologist. I've been in practice for 32 years. I have built my practice to be 5 locations. I now focus on skin cancer surgery. I do a technique called Mohs surgery, where we focus on removing the least amount of tissue with the highest cure rate to remove skin cancers. I have also co-founded a company with my daughter called Get Mister, whose mission is to help men have their healthiest skin.
Nice. Funny thing is, a lot of times we don't have, formulas or things to use for men. People normally gear towards women.
Absolutely. And they deserve better. It's funny
so,
when
too.
I have sold a lot of products in my practice over the years. And I'm telling my male patient for the millionth time, you should use something every day. And the female in the room is like, I try to tell him, or he'll use mine. It's like women love their products. We really search high and low to find the moisturizer we like, the makeup we like. And for men, they just don't have that many options. Mm-hmm. And I think a lot of them just don't really understand what's quality. And I felt like they really deserved better. They deserved as good of products as women have. But we have to keep it simpler for them.
Yes, because if it is too complex, they're not going to use it.
Right.
Awesome.
You will, but I think, most don't want multiple steps. But it's interesting, we did a research project and we interviewed 800, sorry about my dogs.
That's fine.
800 men and 200 women about men's attitudes and behaviors around skincare and skin cancer attitudes. And what we found is a lot of men use product. They use moisturizers and lotions and aftershaves and colognes, but very few use a product that actually keeps their skin their healthiest with an SPF product.
Yeah, I can see that. I can see that happening. And the truth is also, yes, you have men that use it, but you also have men who really prefer something simple like water. Just use water and wash their face and they're good.
Yes. So what we developed is it's an all-in-one moisturizer, sunscreen, aftershave, all in one. So it's like, don't worry about it. Just use this.
Okay.
Okay, just use this. You want a moisturizer? Okay, just
use this. So it's doing everything in one.
Right. It's just simple. Just use it every day. Brush your teeth, use this.
Oh my God, I love it. It's made simple for them. So let's jump into the questions. What are the most common skin conditions?
So I am a little skewed in that I treat skin cancer.
Okay.
And precancerous conditions are very, very common. There are millions of cases of skin cancer every year. The more common skin conditions outside of skin cancer are things like acne, vulgaris, regular acne, like teenage and hormonal acne. Acne rosacea, which is kind of the redness and flushing and blushing and pimples. Warts, they are always the bane of my existence because they're sometimes very difficult to get rid of. Eczema, all kinds of eczema, whether it's dry skin eczema, more of the what we'll call atopic dermatitis, real itchy eczema. Certainly we treat a lot of psoriasis and infections. So as we head into the summertime, we see a lot of poison ivy or what we call allergic contact dermatitis, as well as bug bites and tick bite and things that people get very itchy and then scratch it and then it gets infected. So we see a lot of that. And then humid weather, we see a lot of fungal infections.
So different seasons bring different things.
Right. So you're spot on. In the wintertime, which we're just finishing, you see a lot of itchy people, very dry skin. If we're getting into humid weather, you get more infections and maceration of skin on skin. We call it intertrigo, where like you have wet areas where the skin rubs against each other, like under your belly or in your thighs or under your arms, and that skin can get very sore and tender and break down and get infected. And I was kind of surprised the early part of COVID, I saw a lot of that. I think people thought since they didn't have to leave their house, they didn't need to bathe. I was like, why is everybody coming in with intertrigo? But they were in bad shape. We had our clinic open only for urgent conditions to try to keep people out of the emergency room. So we see things like shingles and abscesses and, things like that. And then a lot of people with intertrigo.
I mean, they're comfortable. They're like, why am I bathing?
Just like, here it is, just every day. But people were so stressed out at that point in time. You just, had pity on them.
Yeah, I can imagine. And you spoke about eczema and psoriasis. What's the difference with those two?
That is a great question. Atopic dermatitis, you often associate with it starting with babies, but it can go all the way through adulthood quite easily. It's often associated with other conditions such as asthma, hay fever, conditions like that. It is a dysregulation of the immune system. And in part because people who have this type of condition, the barrier of the skin is not robust. And so it allows outside, what we call allergens or just irritants from outside to penetrate through the skin where it's not this nice barrier. And so the skin processes it in ways that you create a strong immune response. Also, it's more susceptible to losing water, become dehydrated, and you get in this bad cycle of inflammation, and the skin can't retain moisture, so it gets more inflamed, and then more things can get in the skin. But we're also learning that with eczema, it is actually a systemic illness. It's not just what you see on the skin. There's actually inflammation internally. The only thing that's really got a strong association with it right now is high blood pressure. But they're really looking harder at eczema as a more systemic disease. Both of these diseases can have severe psychological burdens. With atopic dermatitis, a lot of that is also not only the stigmatization of having a lot of your rash in a public area, but also disruption of sleep. And that can lead to depression and anxiety. So that's eczema. No fun to have that.
Not at all.
And with psoriasis is very interesting in that it's a turning over of your skin very quickly and it's inflamed. And we feel like there is more than with atopic dermatitis, but especially with psoriasis, there's this genetic component. Again, to overreact to certain ingredients and things in our environment. And it triggers a huge inflammatory response. So the skin is turning over very quickly. You see psoriasis, like with people scaling. Have you seen that?
Yes.
And so not only do they have tremendous inflammation outside, things like even strep throat or certain medications or any kind of stress can make eczema worse, but it can really make psoriasis worse. But we know also internally there's inflammation in the organs, particularly involving the heart, that increased risk of heart disease, Their insulin resistance is not robust, and so they tend to have metabolic syndrome with high lipids, more tendency to get diabetes. There's also an increased risk of depression as well. There's a lot of associations also with psoriasis, but it's really a systemic disease. It's not just a skin disease.
I've never associated, like psoriasis with insulin resistance or diabetes or whatever.
So we've really learned a lot more. It's not just a skin disease anymore. And anyone who has significant psoriasis should really be working with their primary care doctor to make sure they're staying on top of their heart health.
Oh, wow. What causes hyperpigmentation of the skin? And are they due to underlying issues?
So hyperpigmentation is where pigment production gets transferred into the keratinocytes. And this can be really triggered by any type of rubbing or scratching or any type of inflammation. So particularly for people with darker skin types, while you can get their eczema under control, their psoriasis under control, the hyperpigmentation can be very distressing for them. It can come from a bug bite. It can come from any kind of trauma to the skin, and you can get hyperpigmentation. Certain medications can cause it. Hormones can cause it. Kind of classically, during pregnancy, a lot of women get what's called melasma, but men can get it too. Certain medications can make you get hyperpigmentation. There's a common one with antibiotics called minocycline. Some of the cardiac medicines that help calm arrhythmias can contribute to it as well.
All right, so I think people normally associate hyperpigmentation with probably, you stay in the sun too much. And it burns you and it burns your skin and it affects your skin. So can that trauma also cause it or no?
So any kind of trauma can cause irregular hyperpigmentation. The more diffuse pigmentation, like from sun exposure, is an activation of the melanocytes to make more pigment. And so certain skin types are more robust than others. So, there are people who make no melanin or people who are albino, like
Right.
no melanin, all the way to the darkest skin types. So the irregular pigmentation, I guess, is what I was referring to more rather than the general pigment. So yes, first pigment starts from sun exposure, but then the irregular pigmentation can come from any type of inflammation or trauma.
When should someone try and see a dermatologist rather than self-treat? Because Google has a lot of treatments for us to use.
They do. Recently, there are reports of mercury being in a lot of these hyperpigmentation creams, pigment correcting creams that come from abroad. And mercury is a heavy metal and can be very dangerous and can be absorbed. So if people are going to be using over-the-counter products, they need to make sure that it's really US based, because they really could be getting either high-potency steroids sometimes are laced into these creams, and they can have a lot of side effects, even systemic side effects. The number one thing for having even skin tone and dealing with hyperpigmentation is sun protection. Visible light, which is the light that actually comes from the sun, to a lesser extent indoor, like light bulbs and screens, and that's being debated, can cause that hyperpigmentation. So you want to use a broad spectrum protection. And I prefer the mineral-based ones because you just don't have to worry, the ones with zinc and titanium. And we now know for visible light, you need to wear those in fairly robust concentrations, but also to have iron oxide or pigmented sunscreens can be very effective for darker skin types to help protect them against visible light, which can cause a lot of darkening as well. So the number one thing is using good sun protection. And it's not just using a cream, it's also wearing a hat and wearing sunglasses, because your sunscreen is only going to do so much.
Right.
Over the counter, there are a lot of good new treatments. There's one called azelaic acid. It used to only be by prescription. There's a number of different brands that have this. Licorice root, some soy extracts. There's one called cysteamine, cysteamine. It's a product you leave on for 15 minutes, rinse off. It is rather expensive, that one is. And then certainly hydroquinone was taken off the market with the CARES Act, which as dermatologists, we do not understand. But the gold standard for us is a 4% hydroquinone mixed with a tretinoin, like a retin-A, mixed with a low potency or medium potency steroid to stave off that inflammation. Because we were talking about, that inflammation can cause worse pigmentation. So you have to really make sure whatever you're using is not irritating your skin, because then you're just going in circles. There are certainly procedures you can do to deal with hyperpigmentation, but you have to be careful because it's a slippery slope, because you don't want to, again, with melasma or certain conditions, heat, like using a laser or getting something real aggressive like that can actually work temporarily, but then it's just right back. So things like very light chemical peels can help people with hyperpigmentation to help even out their skin tone. Sometimes microneedling can help as well. But the number one thing is always still the sun protection.
Okay. And it's best to go and see a dermatologist and to still treat ourselves, because we don't know what we're using on our skin, really.
If you are going to use bleaching creams, I would go with some of those more natural options. But understand the prescription products work really well. And we often will rotate back to some of the other non-hydroquinone options once we're done with getting people where they want to be. But again, to go that pigmented sun protection because of the visible light.
So let's talk about what you like to do, skin cancer surgery. All right. So first of all, can you explain the types of skin cancers there?
Absolutely. There are over 5 million new cases every year in the U.S. alone. More than half of all cancers are skin cancers. They're not tracked as well. The basal cells and squamous cells carcinomas are the two most common ones. There are millions of those every year. The less common ones are melanoma. They're younger people who get it and older people who get it. So it's not just a disease of the elderly. There's Merkel cell and lymphoma and some other more rare types of cancers that do occur on the skin. But the most common ones are the basal cell, squamous cell, and melanomas.
Are there signs to look for?
Absolutely. So in darker skin types with melanoma, it tends to be diagnosed later. And when melanoma is diagnosed later, it is much more fatal. People do much worse. So for people who don't really think they're at risk for skin cancer, to know you aren't really at risk for skin cancer from the sun nearly as much as someone with lighter skin. But your melanoma is more likely to occur on the hands and the feet, like the palms, the soles, the nail beds, the mouth, and actually even in the groin. I know for years, everybody I think knows Bob Marley's story. Do you know the Bob Marley story?
Mm-hmm.
Are you aware he died of melanoma?
Yes.
Yeah. So a lot of people of color don't realize what they should be looking for, and also people of Asian descent. That's where they tend to get their melanomas, not so much where the sun has been shining. You want to look for anything that's changing and different. It could be a nail band, it could be a mole on your foot that's been there for years that's all of a sudden changing, or a new mole that's changing. You don't want to wait for it to bother you. Skin cancer is not like lung cancer. You don't know you have it. Skin cancer is there for you to see it and catch it really early. There are a certain small number of skin cancers that are just bad from, day one. You never had a chance to really catch it early. But to know what your skin looks like, so you know if there's a change. So we'll look for kind of a mole that looks different from all the other moles on somebody's skin. So they may have 25 moles, but this one looks a little different. And it could be new or an old one that's changing. The most common type of skin cancers, and we do see these in all skin types, they're just more common in lighter complected folks who are more at risk for more sun damage, but all skin types can get these. We look for something that is really kind of normal looking, but it just won't heal. It's not acting normal. So I took off about 12 today, and I always like to hear people's stories, like, how did it start? And today I can't tell you how many times, it started as a pimple, it just wouldn't go away. Yes, this was a dry spot. I put lotion on it, it just wouldn't go away. I have this little bump, it just kept growing and changing. And then what's less common, but I did have a patient today where it looked like a scar, but they'd never had anything there. And it just kept growing and changing. So I'm making you feel real happy, right?
I don't know. You have me looking at my skin. That's what you have me do.
What I encourage people to do is, get a lighted magnified mirror and once a month really look and see what's changing, what's different or new. Ask your hairdressers to help you check your scalp. Have a friend help you check your back. And there's great websites that will show you how to do a home skin self-exam. So you know what's there and you can detect much better if something's new or changing. And cell phones are so good now. You know, the resolution, the pictures, take like pictures of your back and your chest and your arms and your legs, have on your underwear in case, somebody grabs your phone.
Right.
But you can monitor even with just at home. There's an app called MySkin, MIISKIN, that will help you know like which ways to point the camera so that you can get most of your body surface area and you can monitor. So you can refer back and go, oh gosh, I guess I have had that mole. Yes, it has always looked like that. Or, oh wow, that's new, or that looks really different. Because if people know what to look for, they can catch things early. And that's why I'm so passionate about letting people know what to look for.
You have persons who, if they see a wart and it's probably changing, they just say, oh, pressure's probably changed, and leave it alone. People don't generally think, oh, it's changing, let me go check it out. You know what I'm saying? So no, it's basically that we now have to self-advocate for, we have to go out there and say, no, I want to check on myself and be more aware of things.
And I'll tell you, only about 15% of people actually see a dermatologist on a regular basis.
Wow.
Many of my patients have come in with skin cancers because their friend or someone they work with knows about skin cancer and told them they needed to get it checked.
Wow.
So you can not only help yourself, but you can help others if you know what to look for. One of my first experiences was that when I was in training, a young man came in and he had a spot of concern on his chest that ended up being an invasive melanoma. And I'm like, he goes, I didn't know anything about it. I just happened to be playing basketball and I ended up on the team with no shirts, the shirts and no shirts basketball.
Mm-hmm.
He goes, my friend came up to me and said, hey buddy, you should get that checked out. That didn't look good. He goes, it's not bothering me. He goes, no, I know about these things. You should get it checked. And his friend saved his life. He really can make a difference if you know what to look for.
That's the thing. So research is important, because if you don't know the research and you don't know what to really look for, you really don't know how to help. How do you know if it's just a wart or a spot or a bump or a mole? How do you know?
So usually if you've got a pimple, all pimples should go away in 3 or 4 weeks. Your skin turns over about every 5 to 6 weeks. So if it's there for more like 6 weeks, it's not your normal pimple, right? If it keeps kind of going through being red and it doesn't have to hurt, but just that it won't heal. And then a dry spot, you put maybe Cordate on it, you put some moisturizer on it, and here we are a month or so later, it's still there. Now, if you have eczema, that's one thing, all over your body, but if you've got one little dry spot, to get it checked out. And then if you're waiting for something to hurt, then that's way too long. So that's where we're talking about the freckles, if it's changing, so to know what it looks like. So a waxy bump that's just there is okay, but a waxy bump that's continued to grow and change, not necessarily okay.
All right, so sometimes some persons have the warts that's flat, right? And then the one that's raised. Or sometimes it gets flat and then it raises. They really do need to check it out if that changes also, or sometimes that's just how it comes up.
If it comes up elevated to begin with, like a melanoma, and again, melanomas can be pink. They don't have to be darkly pigmented to be cancer. They can be any color. We do worry more that it's become more aggressive. But I've had people come in whose spouses are physicians, and I'll say, how long have you had this on your back? Oh yeah. My spouse, the doctor, kept telling me it was fine because it was flat. It's like, oh gosh. So there's often, particularly with melanomas, this what we call horizontal growth phase, where you have a long time months usually to catch it before it becomes aggressive. And that's when, if you have a flat area, then it gets a bump in it. That's not good. So you want to come in while it's growing and it's just still flat, like you can't really feel it. With those, we look for asymmetry, irregular borders, variable color, getting larger in diameter, but E for evolving. So something that's evolving and changing.
Okay.
So you can have sun freckles, but if one of your sun freckles is starting to look really different from the others, then you might want to get it checked out.
Okay. What factors influence skin cancer?
Family history, your immune status. So if you've had like a kidney transplant or if you're on medicines that suppress your immune system, that can put you at high risk for skin cancer. So other things about your general health, if you've had leukemia or lymphoma, even if it's remission, that can give you troubles. If you've had a history of skin cancer or a family history again of skin cancer, if you've been in tanning beds, that can definitely increase your risk. If you've had extensive exposure to radiation, that can as well. Multiple sunburns over time. And if you have a lot of moles, you're at more risk for skin cancer as well. Red hair, blonde hair, freckling, failure to tan.
Man, is skin cancer a death sentence?
Absolutely not. Most skin cancers are highly curable, which is why that's what I like to treat. Curing cancer every day is kind of cool. I'm really energized by that. I love my job. So basal cells, they metastasize or spread literally 1 in a million. So they're very treatable, but they can be very disfiguring and they can be very locally invasive. So if you've got a basal cell and you don't treat it by your eye, you can lose your eye, your nose, a lot of your ear. So you want to take care of these, even if they're not really that bothersome to you. With these, they can cause death because they can burrow through bone into your brain. It can be bad. And they're so treatable. So we never want people to go through that. There are some people who have aggressive basal cells, and they need to be treated very quickly and appropriately. There's some new advances, so that's pretty good. Squamous cell carcinomas actually kill more people than melanomas do because we just have so much more of them. And they can metastasize. Usually they're aggressive, like people who don't have a good immune system, people who've neglected them. If it occurs in a burn scar with squamous cells, usually it would spread initially like to a lymph node. And again, there are some exciting new treatments. Melanoma, it happens most commonly now in women who've been in tanning beds and older men. And if you catch it early, it's 98% curable. If you don't catch it early, it goes down to 66% for 5 years. And because it can affect young people kind of disproportionately, although I see people in their 20s and 30s now with basal cell and squamous cells, the melanoma is like once you've had one, you're liable to have another.
Oh, wow.
Of those. Same thing with the others as well. But, if you have a worrisome cancer that can spread, it takes you pause. But again, if you catch it early before it's gotten thicker, that's how you can tell if it's high likelihood to spread, then it's highly curable. It's exciting. There's a lot of new treatments out, but you don't want to have to even go there.
Right. Who is most affected by skin cancer?
I think if you're, a child of, a young child of a father who dies of melanoma, who can you say is most affected by that happening? I'd say, was the question who's most affected by it?
Yes.
So men have 3 times more cancer than women of skin cancer over their lifetime. Wow. But plenty of women do get skin cancer. The older you are, the more likely you are to get it. And I've kind of beaten home about the tanning beds.
Yes.
Even just one tanning bed experience doubles your risk of melanoma.
So you're just not supposed to get tanned like that, really?
Not a tanning bed. It's a carcinogen. The World Health Organization has labeled it as a carcinogen. And there are still like little girls who participate in these competitive like cheerleading competitions and things like that. And the coaches and the mothers are still getting them tanned. I mean, it's just awful.
Wow.
They've actually banned them in Australia.
Really?
So in terms of who gets skin cancer, again, people who have lots of moles, who don't tan easily, red hair, blonde hair, light-colored eyes, people who've had a lot of sun exposure, but anyone can get it. Again, most skin cancers come from sun, but not all.
Not all, right. And you said there are many cures for skin cancers, which is good, as long as we catch it earlier.
So surgeries usually are just done, it's kind of like if you have a bad root canal, that's usually what it's like to have skin cancer cut off your face with. Usually if we catch it early enough, you don't have to have reconstruction. You just have a few little stitches maybe, or some scraping and burning, and occasionally creams. Okay. We are using more superficial radiation, which is different than like the radiation you get for, say, breast cancer. It's It's really just for skin cancer. It just goes a few millimeters into the skin.
Right.
You do have lots of short treatments so you don't get breakdown of the skin. So it's about 16 or 17 very quick treatments over the course of a month and a half. And there's much less scarring. We use it a lot in people who aren't great surgical candidates. And that's usually people who are very elderly and frail on blood thinners, people who would have a very disfiguring surgery, like on their ear. They lose a lot of their ear, but they can have radiation instead. And there's some new creams coming out that look like they're going to help address at least the very early skin cancers.
Awesome. I'm happy to hear. Man, I mean, this is so much information that I didn't even know. And it's surprising the things that are really out there.
Well, the melanoma treatments are really exciting because they're just tweaking the immune system to be able to fight off the cancer better. The old chemotherapy, you just kind of poison the tumor and you hope you didn't poison the patient so bad. That they could survive the poison. So treatments have gotten a lot better, but it's still better to catch things early or not get them at all.
At all. So take the proper procedures or the proper things in order to protect ourselves from this. Where is it that we can find you?
Oh, I'd have to tell you about my company more. So we have a company with my daughter, and you can be working with her. It's called getmr.com. And we have an all-in-one, we talked about cream for men, a daily lotion. It's not a cream, it's a lotion.
Okay.
For men to use every day, just like they brush their teeth. Of course, if you're out for longer, you need to wear a hat and sunglasses and a shirt. But that is where you find me. And on TikTok.
Boy, yes.
Thank you to my 25-year-old daughter and business partner. It's DERMDR, Goldstein. And on TikTok, I'm trying to really use it to educate people about signs of skin cancer and to get really correct, credible information about their skin.
I think you're doing good. I've been watching them, both the TikTok and on your Instagram. Yes.
Oh,
it was so good having you and having this discussion.
It was delightful being with you. I hope it wasn't too much.
No, it wasn't. I really enjoyed it. You had me looking at my skin and making sure everything's okay. I think that's what we're supposed to do. So thank you so much again for sharing this knowledge. I really appreciate it. And I'm sure my listeners also would appreciate this. And thank you again for listening to the Unfiltered by Jade. We'll be back next week, Tuesday. Thank you. Bam, 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 bam,